Okay, all right. Now we continue to the next family, your picoRNA viridae. So as you can see, same siya with how I pronounce with HepaDNA. No? So sa una po, history lang, inanagay po na pag-pronounce, picorna viridae. But again, through Sir Gemu, my lords, okay, my idol, pray for us, charot. Ako siyang i-pronounce as picoRNA. So pico, nasa pangalan na, pico, it's from the Italian word piccolo, which means small. All right? So small RNA. picoRNA viridae, di ba? So nasa pangalan na, it's an RNA virus na small, no? picoRNA viridae. True enough, single-stranded RNA genome, walay envelope, and the genome already resembles a messenger RNA. So meaning, pag sulod niya sa cytoplasm, sa host cell, pwede nang agad-agad ma-translate iyahang genome para mahimong proteins sa iyahang virus. So, di ba? Ina na siya ka-effective. Now, what are the viruses here? Of course, the enteroviruses. Take note of that. Enteroviruses, and what are examples of enteroviruses? You have the Coxsackie virus, A and B, the Polio Virus, nako, very important, the Ecovirus, and of course, other enteroviruses. So again, di ba, we have discussed na Ecovirus, unsayahang meaning, eco, enteric, cytopathic, human, orphan virus. So lumabas sa boards there, actually, unsay meaning sa eco, or gi-describe din siya, the enteric cytopathic human orphan virus was first discovered without attributing any disease. What is this virus? Of course, ang answer nato is ecovirus. Gi-describe ra tong meaning sa eco, and then ang choice kay ecovirus. So ang answer ato ecovirus. So nigawas na sa board. Nigawas pud sa boards ang Rhinovirus, respiratory enteric orphan virus. So ngano ganing orphan? Because these viruses were first discovered without attributing any disease to them, no? Nakitan sila una before the disease. Ayan, so walang orphan. Okay, anyway, we'll start first with the first group, the enteroviruses. These are all fecal oral. Okay, fecal oral gyud iyahang mode of transmission. All right, and we'll start first with the disease, of course, the polio virus. Very, very important, no? Polio virus. All right, polio virus, usually they infect your CNS. All right, and the CNS, from there, dito sila mukos na og infection. So, di ba, fecal oral route man siya, of course, magsugod siya sa imuhang tiyan. Because again, they are non-enveloped, remember? So, ilahang capsid is very resistant to a lot of changes, including na sa imuhang gastrointestinal tract na acidic. That's why they are transmitted fecal orally, because makasurvive sila sa imuhang acidic environment. Okay? So, therefore, ang imuhang polio virus mag-start there, dito sila mo divide, and then mo spread na sila through lymphatic system, padulong na sa imuhang neurons, and sa peripheral nerves, padulong sa imuhang brain, actually. Alright? And the viruses will destroy now the neurons kung asa sila gikan or kung asa sila nag-infect, and may cause paralysis. Alright? Okay, and that's the most important effect of your polio virus. So it can lead to it can lead to paralysis because the enteroviruses, your poliovirus example, are cytolytic. Ilahang ilay ang cells, no? So therefore, kung sa neurons nila, ilahang i-damage ang neurons, which proceeds or which happens or which leads to your paralysis. All right. Okay. Okay. Ayan, sige. Now, again, as you can see, ang disease sa polio, it may exhibit a lot of types, pwedeng asymptomatic. Majority of infections with polio virus are asymptomatic. Pwede siyang abortive poliomyelitis, meaning during sa pagpanganak or during sa sulod pa lang sa fetus, alright, pwede na siyang ma-infect by the polio. Next, you have the non-paralytic poliomyelitis or aseptic meningitis. Again, sa brain, yapon siya, it infects the meninges and causing back pain, muscle spasms. In addition to minor symptoms of the illness. And of course, the paralytic polio, the major illness. So again, it leads to paralysis, no? Spinal cord and the motor cortex of the brain, ilahang mga cells can destroy sa virus. And the severity of paralysis is determined by the extent of neuronal infection. Pila ka neurons ba ang na-infect sa virus? So kung mas daghang neurons, mas daghan pod or mas intense ang paralysis. All right. So asymmetric flaccid paralysis with no sensory loss. Meaning murag luya lang imuhang luya imuhang pag-paralyze and walay sensory loss. All right, okay. The paralysis may progress over the first few days and may result in complete recovery, ma-recover baka, residual paralysis meaning na part ng sa body na paralyzed, or death also. Because again, pwedeng ma-affect imuhang mga muscles, no? Diri dapita sa imuhang chest, so maglisod na kag-breathe, or other important muscles necessary for function. So pwede kang mamatay. All right, okay. Ayan. Now, another type of poliomyelitis is bulbar, B-U-L-B-A-R. It may involve the muscles, no, of the pharynx, vocal cords, and respiration. So therefore, magliso na ginhawa ang patient, pwede siyang mahimong, or pwede siyang mamatay. All right. Now, post-polio syndrome is a sequelae of your poliomyelitis. The polio virus is not present, pero the syndrome is believed to be a result of the loss of neurons affected by your polio virus. All right. So true enough, in the later mga early years, yun mga 1900s, no, there are outbreaks of polio. All right. And the polio virus again caused paralysis. All right. And majority of the children usually affected. Napabakoy tingog, yes. The majority of the polio of the children affected by polio, maparalyze ilahang diri dapita, no, sa body. So maglisod sila og breathe. Therefore, most of them are encased in what we call an iron lung. Nako, I think nakakita na mo ana. So, na picture later sa atuang presentation, the iron lung. So, basically, mara siya og container. It's a respirator before kung asa isulod ang imuhang patient na paralyzed with polio. Alright? Because paralyzed na iyahang muscles diri, magdiso na siya ginhawa. So, it's the iron lung or metal respirator that will provide or that will facilitate the breathing of the patient. And nagya po'y surviving iron lung patient, si Paul Campbell. Nalimutan ko sa ngalan, basta Paul, no? Si iron lung Paul. Siya na lang nabilin na nag-iron lung, which is again an effect of polio virus infection. All right. So again, that's your iron lung, a metal respirator, again a chamber, no, respirator for patients na na-paralyzed na during the pita because magliso na sila ginhawa. All right. Okay. So that's for your polio virus. Okay. Now for polio virus, thankfully in the recent times, wala na tayo kayo cases of polio virus. Why? Because again of vaccination. Now your vaccination, all right, there are two types. You have the Salk and the Sabin or Sabin. Your Salk was first discovered by Jonas Salk, and ang Sabin was discovered by Albert Sabin or Sabin. All right. Your Salk is intradermal na intramuscular na vaccine. Your Sabin is oral. All right, Sabin is oral. So kabantay mo sa mga commercials or like sa atong mga commercials diri sa DOH, di ba? Ang polio virus kay katong nai-drop sa bata na murag ipainom na liquid, that is the Sabin vaccine. Okay, because that is oral. Ang Sabin nowadays ang mas ginagamit because your Sabin is much cheaper and it's much less invasive, and of course it's easier to administer. Kay mo ragong ipakaon or oral ra siya sa imuhang bata, and it's really effective po. All right? All right. Now there have been reports recently, no, in the Philippines of the emergence, no, the re-emergence of polio virus because again of decreased vaccination in the Philippines because again of vaccine hesitancy na po and all that. But thankfully, through the efforts of DOH, mga ibang tao dyan except sa chief, department chair sa DOH, no, sa secretary, except niya, sa efforts sa DOH, no, na control, no, nabalik na po ng polio virus. Na-control ang epidemic, ang outbreak sa polio virus sa Philippines because of the constant efforts of the people in the community, mga barangay health workers, no, mga nurses and all that sa community sa pag-vaccinate sa mga children yun. And na put in control na siya. So recently lang to, I think, ni-announce ang WHO to, I think mga March of 2021 or mga May, something like that. No? So very good, thankfully good. That is because of vaccination. No, we have two, Salk and Sabin. Si Sabin atong ginagamit because it's easier, no, to administer, it's cheaper, and it's less invasive. So how do I remember kinsa tong oral, kinsa tong intramuscular? So Sabin, di ba? Sabin sa Tagalog, may gusto kang sabi, pag sabi, di ba? If nakay sabi, na sabi, di ba? Pag sasabi, di ba? If mo gamit kag mouth. So therefore, Sabin, sabi, no? Sabi, gamit kag mouth, Sabin. So Sabin ang oral. Okay, and si Salk ang imuhang intramuscular. All right, so those are the vaccines for your ano ni? For your polio virus. All right. Okay. Now we go now to the other viruses. Okay. We go now to the other viruses. Your Coxsackie A virus. So the Coxsackie A and B viruses, these are viruses named after the place kung asa sila na-discover, which is Coxsackie, New York. All right? So Coxsackie A, Coxsackie B, different diseases iyahang makos. For Coxsackie A, siyang makakos og what we call herpangina. Herpangina, which are characterized by vesicular lesions in the soft palate and uvula. So, mura gyapon siya mag-fever ka, mag-prodrome syndrome, and all that. Ang Coxsackie B is more on the body involved, and it causes what we call pleurodenia, or also known as your devil's grip or Bornholm's disease, no? Because again, pag inhale nimo sakit, chest pain, intense chest pain. Ayan. It may cause pericarditis, myocarditis, and it can also cause type 1 insulin dependent diabetes because again of destruction of the beta cells sa pancreas, no? So virus in the beta cells of the pancreas, it can cause destruction there caused by Coxsackie B virus. All right? So si Coxsackie B, siya ang naay body, letter B, body involved, myocarditis, pericarditis. Si Coxsackie A, siya ang involved sa herpangina. Daghang letter A, di ba? Herpangina. So siya ang involved sa Coxsackie, or siya ang cause ana niya kay Coxsackie A. Daghang A, herpangina. It's caused by letter A. Okay. Aside from that, your hand, foot, and mouth disease. Nako, very important. Nako, hand, foot, and mouth disease is caused by Coxsackie A16. All right. So hand, foot, and mouth disease. It's called hand, foot, and mouth disease because of the lesions na makitaan sa hand, sa feet, and sa mouth po. All right. Usually seen in children. Okay. All right. So hand, foot, and mouth disease. Pero kung foot and mouth disease ra, walay hand, lahi na virus na siya. Kinsa man to? Your foot and mouth disease is caused by your Astro Virus. Please take note. Astro Virus. Astro Virus, the causative agent of your foot and mouth lang. Foot and mouth disease. Wala na hand. Basta kung nanay hand, foot and mouth, that is caused by Coxsackie A. Pero kung foot and mouth ra, it's caused by Astro Virus. Still the same under family gapon ni siya. Same family lang, picoRNA. Pero your foot and mouth disease usually is seen in animals. Okay? Your hand, foot, and mouth disease sa mga children, na lesion sa hand, sa feet, and sa mouth. Okay? Alright, so, pero kung foot and mouth na, wala na hand, it's caused by Astro Virus. Okay. All right. Ayan. So that's for the Coxsackie. Again, Coxsackie B, her pleurodenia, no? Devil's grip, chest pain pag inhale. So magigunitan daw sa devil pack or Bornholm's disease. Okay? And herpangina is caused by Coxsackie A. Daghang letter A ang herpangina. So kinsay causative agent? Katupong letter A, Coxsackie A. All right. Okay. Now, enterovirus 70, it can cause acute hemorrhagic conjunctivitis. And many enterovirus types, again, it can cause summer flu. So, mas dagan sila sa summer. Ecoviruses, Coxsackie, may also cause neonatal disease. And your enteroviruses are considered to be the most common cause of aseptic or viral meningitis. Take note of that, dears. Most common cause of viral aseptic meningitis, all right, is your enterovirus. So, do not forget, okay, do not be confused with meningitis and encephalitis. Pag meningitis, inflammation of the meninges. Ang encephalitis, inflammation of the brain mismo. Okay? Alright, so take note of that. Kung most common cause of viral or aseptic meningitis, this is your enteroviruses. Pero most common cause of viral encephalitis, this is caused by HSV, herpes simplex virus, usually HSV1. Okay? Most common arboviral encephalitis, meaning encephalitis caused by an arthropod-borne virus, kinsa to? Japanese encephalitis. Okay, please take note of that. All right. Now for culture or for diagnosis, cell culture, ang Coxsackie A, again, na-mention na to, ganyan siya suckling mice, katupang baby na mice. So live good na mga mice. It also likes PCR. Of course, diagnosed through PCR and serology. And of course, aseptic meningitis, sa CSF, remember, sa inyong AUBF, di ba? CSF, it lacks neutrophils, normal to slightly low ang glucose, and aside from that, elevated proteins. That's why, di ba, ang iyahang counterpart sa aseptic is septic meningitis, which is caused by bacteria, di ba? So septic meningitis caused by bacteria, aseptic or aseptic meningitis virus. And again, isa itong most common cause of aseptic or viral meningitis, enteroviruses. Please take note of that. All right, okay. So that's for the first members, no, of your entero viruses. Okay. All right. Okay. All right. Sige. Next, we go now to your hepatitis A. Ayan. So another hepatitis virus under family picoRNA. So siya ang hepatitis A virus or iyahang old name kay enterovirus 72. Okay. So again, it's transmitted fecal orally. All right. This is considered to be the hepatitis with short incubation period, and this is the non-infectious na hepatitis. Siyang infectious hepatitis. Sorry. Siyang infectious hepatitis. All right. Self-limiting disease. All right. Self-limiting disease. Wala siya carrier state, okay, di po siya mo-proceed to chronic infection, and low ra po iyahang mortality rate because again, it's self-limiting, meaning ma-resolve ra siya within pila ka days or pila ka months, all right? Your hepatitis A virus is also the only hepatitis virus that can be grown in culture. Although it's difficult to grow in culture, among all the hepatitis viruses, it's considered to be the most easiest, no? Siya mo grow sa culture, all right? And I think siya po ang first hepatitis virus na nag-grow sa culture, all right? Your hepatitis A virus. Again, on sa mode of transmission, fecal oral. Nako, ayan, na-complete na ito ang mga fecal oral na hepatitis, mode of transmission ng mga hepatitis virus. So, kinsa itong mga fecal oral na hepatitis viruses na ma-transmit? Natin mnemonic for that. Medyo bastos, pasintabi sa mga kumakain. Okay, kung naglantaw mo ani nagkaod. You have a mnemonic, tae. Sorry, pasensya. Ayan. Letter A and letter E can be transmitted fecal orally or ma-transmit sila through tae. Okay, ayan. The rest of the hepatitis virus B, C, D, G, and E, B, C, D, and G, they can be transmitted through blood and body fluids. All right? But for A and E, tae, okay, siya ang ma-transmit fecal orally because ma-transmit siya sa tae. Okay, very easy to remember, di ba? Ayan, don't forget. Kinsa itong mga hepatitis viruses na fecal oral ang route of transmission? Tae. AE, hepatitis A and hepatitis E na virus. All right, okay. Now, the last member of your picoRNA viridae are your rhinovirus. So, nasa pangalan na, rhinovirus, ayan, rhino meaning nose, no? So, this is the common, the cause of your common colds, all right? Now, your rhinoviruses, they like to reside in colder temperatures, usually 33 degrees Celsius. That's why nasa sa nose makitan. So, siya yun ang most common cause of your common cold. Siya yun ang common cold na makakos or causative agent. So, you have sneezing, rhinorrhea or runny nose. You have nasal obstruction, mild sore throat, headache, malaise, pero wala yung fever. And this is self-limiting rapod. So, therefore, for diagnosis, usually, dili na kailangan i-culture, no? But if you want, pwede siyang i-RT-PCR pod. Pero again, because of presentation, symptoms palang daan, pwede na siyang ma-diagnose. Alright? So, cell culture is not routinely recommended. Now, take note, your rhinovirus is acid sensitive. Take note. In comparison to your enteroviruses are acid resistant. Remember, they are enteroviruses. Therefore, because again, they can be transmitted fecal orally, they can withstand the acidic environment in the stomach. All right? So because of their resistant na capsid. However, your rhinovirus, it's acid sensitive. Di ba, muna siyang usahay mo yun sila na, o inom og mga, or kaon og mga fruits na medyo acidic, such as mga lemon, mga orange, kaya na mga citric acid to cure your colds. Because of this reason, your rhinovirus is acid sensitive. O, di ba? Ayan. So, natin mga relations na nahita po. Ganun. Okay? Alright. So, that's for the rhinovirus and the picoRNA viridae na family. Okay. All right. So that's for the picoRNA viridae family. All right. So again, here's a picture. You have here the polio virus. Ayan. Enterovirus, Coxsackie, hand, foot, and mouth. As you can see, may mga lesions both sa hand, sa foot, and sa mouth. The polio vaccination using Sabin or Sabin, I'm sure nakakita na mo ginani, and the iron lung. As you can see, this is used to facilitate breathing of patients na paralyzed na, diri dapita. Ilahang muscles for breathing paralyzed na, so therefore, di na sila ka-breathe properly, they need the iron lung. Okay, hello, all right, ayan, sige. So that's for your picoRNA viridae. Okay, ayan, sige. That's for picoRNA viridae. And again, for summary, ayan, kinsa to unsa mga diseases ma-cause niya. You have paralytic disease, of course, daghang possible, but again, polio virus, that's a common characteristic. You also have encephalitis, meningitis, silang tanan, possible. All right. You also have pleurodenia, kinsa ra na? Si Coxsackie B. No, devil's grip. Okay, sakit pag breathe nimo, chest pain, intense chest pain, or Bornholm's disease. Herpangina, daghang letter A, that is caused by Coxsackie A. Hand, foot, and mouth, hand, foot, and mouth disease, again, this is caused by Coxsackie A. Ayan. And orchitis, pwede po ng Coxsackie B. Kabantay mo na ang Coxsackie B, usually, iyahang disease kay involving the body. Alright? Not only limited sa respiratory tract and all body, gyud, no? So, muna siyang letter B. Coxsackie B, body. Okay, to remember. Alright, that's for the picoRNA viridae. Alright, okay. Next, we go now to the Rheoviridae family. Ayan, REO, di ba? We have mentioned now sa meaning sa REO, the respiratory enteric orphan virus. Again, ano silang orphan because they were first discovered before they were associated with a disease. All right. Now again, segmented, double-stranded RNA genome, icosahedral, capsid with no envelope. All right. So, kanisa merge dapat ni siya dear sa wala na ko na merge pasensya. All right. Okay. Now for the viruses, we have the Orthorio Virus, and under that is of course the Rota Virus. Your Rota Virus is considered to be the most common cause of viral gastroenteritis in children and infants. Please take note. The most common cause of viral gastroenteritis in children and infants, your Rota virus. So transmission is still fecal oral. Pwede siyang from inanimate objects, fomites, and also aerosols. All right. Now, rotavirus, again, it causes your human infantile gastroenteritis. Could be fatal if dili maagapan dayon. And it usually happens in winter. That's why it's called the winter virus. All right. Now, stool, walay fecal leukocytes, wala po blood. Because again, it's more on the secretory type of diarrhea, malabsorption, and maldigestion po. All right. Okay. Ayan. Now, adults may be asymptomatic. All right. Now, Orthorio Viruses, another group of viruses, they don't usually cause significant disease, but they can sometimes cause mga mild URT infection, upper respiratory tract infection, GI disease, and biliary atresia. All right. Now, for diagnosis, direct detection using AIA, latex agglutination, RT-PCR. All right. Cell culture of rotavirus, it requires pre-treatment with trypsin because it can be difficult to cultivate. All right. So that's for rotavirus. And so you remember lang, again, the most common cause of infantile severe gastroenteritis throughout the world. All right. So your rotavirus, it can survive the acidic environment of the stomach. That's why pwede siyang maka-establish og infection sa imuhang intestine. What was that? Okay. Ikapoy na ako. All right. Ayan. Sige. Okay. Next, you have your Viruses, which causes your Colorado tick fever. So this is a vector-borne disease, and it is caused by the tick Dermacentor andersoni. So this is a deer tick, if I'm not mistaken. So common na siya dito sa mga areas sa Colorado, sa US, no? Usually, the hosts are your squirrels, chipmunks, rabbits, and deer. So dito makita ng virus. Now, for disease, it resembles your dengue fever. So same like po, no? Breakbone fever, no? Malaise, myalgia, and all that. But it can cause or it can progress to hepatosplenomegaly, photophobia, arthralgia, and leukopenia. So, iyahang major hallmark is leukopenia, both of neutrophils and lymphocytes. All right? And may also experience or may progress, ang mga children may experience hemorrhagic fever. So, mas intense as children possible. All right. Now, diagnosis is detection of the viral antigen, immunofluorescence, RT-PCR, and also recombinant immunoassays. Okay, all right. That's for your Rheoviridae. Again, very important lang, si rotavirus and si Colorado tick fever na virus, Colty viruses. Again, rotavirus, the most common cause of infantile severe gastroenteritis throughout the world. All right, okay. Ayan, that's for Rheoviridae. So here is your structure. You have the rotavirus and the Colty virus. Okay. All right. Ayan. So that's for the Rheoviridae family. Next, you have your Retroviridae. Nako, Retroviridae, wag na maisip. Of course, first virus to come in mind is, of course, the HIV. Okay. So your Retroviridae, but the first type of retrovirus that was discovered was the Rus or Ru sarcoma virus, which infects chickens. Okay. This was the first retrovirus to discover. Pero in humans, if ang question gani, which of the following is the first retrovirus to be discovered? Atong answer kayon sa man. Of course, HTLV1. Nasa pangalan na. That's why it's number 1 kaya siya ang unang na-discover na human retrovirus that caused disease. Alright? Your HIV, take note, di ba? Remember on sa old name niya, HTLV3. Siya ay katulo na HTLV. So, dili siyang first. Okay? Huwag na mag-isip. Kung ang question is the first human retrovirus to be discovered, on sa answer, HTLV1. Your HIV is not HTLV1. Remember, ang old name ni HIV is HTLV3. Okay? All right. Now, characteristic again, single-stranded RNA genome. Very important lang na characteristic or iyahang naa is of course the presence of the reverse transcriptase. All right. And reverse transcriptase is described as RNA-dependent DNA polymerase. Nako, baka lumabas sa boards, dili reverse transcriptase kay common na kayo ng reverse transcriptase. Ang mugawas kay RNA-dependent DNA polymerase. Nako, alam nyo na. So, unsa na siya? Ang reverse transcriptase. Describe lang. RNA-dependent DNA polymerase. Okay? Alright. So, that's your reverse transcriptase. True enough because again, siya may mo convert sa RNA padulong DNA. So, in a way, it's a DNA polymerase. Nya ang iyahang convert is RNA. That's why it's RNA-dependent DNA polymerase. Take note, the other name for reverse transcriptase. Nako talaga, I feel like i-question ko ni sa boards po. Okay, don't forget that. All right. Now, for the different viruses, of course, we have HIV, human immunodeficiency viruses. You have HIV-1 and HIV-2. HIV-1 is the prevalent cause good of worldwide HIV epidemic and infection. HIV-2 is much common in Africa. Endemic siya in Africa. All right. Now, transmission, of course, sexual good ang pinakauna. But aside from that, pwede ang perinatal, pwede pong parenteral. All right. So, through mother to fetus or through exposure to contaminated blood or body fluids. All right. Now, for diseases, of course, alam nyo na. HIV can progress to AIDS, especially if unsay CD4 cell count less than 200 cells per millimeter cube. Less than 200 cells of your CD4 cell count per UL or millimeter cube. So if less than 200 na, then the patient is considered to be AIDS already because your patient is now susceptible to a lot of opportunistic infections. All right, so that's for your diseases. And for diagnosis, of course, it's more on serology, no? Viral nucleic acid, of course, nucleic acid detection, mga nucleic acid test, mga NATs, no? NATS. Of course, serology using detecting markers of HIV, ang mga proteins and antibodies to HIV. And of course, different serological tests such as enzyme immunoassays and of course, unsay confirmatory Japan gold standard serological test for the diagnosis of HIV, your Western blot. But actually, nowadays, murag gina-change na siya. Di na siya Western blot, no? Murag padulong na siya enzyme immunoassay or other methods or even RT-PCR na. Pero still, for serological gold standard, it's still Western blot. Yeah, again, say positive sa Western blot, napay Western blot dapat na ay 3 bands, no? At least 2 of the 3 dapat ang naa. P24, GP41 and GP120/160. So dapat mo na siya present. Any of the 2, you're considered positive with HIV. All right? So Western blot. Okay? Take note of that. Nako, review na sa yung IS. I'm sure na-discuss na siya. Okay. All right. Ayan. Sige. All right. Okay pa ba? Okay pa ba? Okay pa? Hello? 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 Alright, ayan, sige. Sorry, dear, akong gitest, no? Kay ako na pong usa sa GMIT, so basin niya. Oh my God. Alright, now another group of viruses is, of course, the HTLV, your human T lymphotropic viruses, especially HTLV1, because your HTLV1, siya yun ang makakos og disease to humans. And unsa na disease yung makos? Leukemia. So this is now the next oncovirus na atong na-discuss. It can cause leukemia, your adult T-cell leukemia, HTLV1. All right. And it can also cause what we call tropical spastic paraparesis, all right, in which your HTLV1 kay nasa brain and causes demyelination of your spinal cord and paralysis. So that's tropical spastic paraparesis. So naay paralysis because of demyelination. Tangtangon ang myelin sheath sa imuhang spinal cord. All right. Now HTLV2 usually dili kay mo cause of disease pero it was first discovered from a patient with hairy cell leukemia. All right. It can cause also HAM, HTLV associated myelopathy such as your tropical spastic paraparesis. All right. HTLV5, it causes or isolated siya from a patient with malignant cutaneous lymphoma. So as you can see, nasa pangalan na, human T lymphotropic viruses. So it's more, sila na mga viruses associated with mga lymphotropic na diseases such as leukemia and lymphoma. But among the HTLV, ang HTLV1 yun ang makakause of disease. Again, on the disease, adult T-cell leukemia. Please take note of that. All right. Now, your HTLV is usually screened in the US blood banks because of high incidence among drug abusers. Okay? So, in the Philippines, parang wala pa ni siya. All right? But again, take note of these viruses. So, for diagnosis, again, more on serology, detection of viral antigens and antibodies, and of course, RT-PCR. Now, take note of this statement na sa ilalom, dears, kanisha. I got this from Jawets, no, or Yawets, no. So, a friend of mine in medicine, asked me, no? Or napadama siya sa iyang quiz sa para sa micro nila sa CIM, no? Medicine. And then, ang question nato kay, which of the following are opportunistic infections in untreated AIDS? So, ang topic ato kay mga Cryptosporidium. So, of course, ang akong gi-answer kay Cryptosporidium. But, according to Jawets, daghan pa rin sila. Silang tanan na protozoa from Toxoplasma until Cryptosporidium. So take note of this, ikan ni sa Jawets. Kinsa to mga considered to be opportunistic infections in untreated AIDS patients. So for protozoa, Toxoplasma, Gondii, Isospora belli, and of course Cryptosporidium species. Fungi, of course, Candida albicans, Cryptococcus neoformans, Coccidioides, Histoplasma, and Pneumocystis. For bacteria, daghan pug kaayo, and of course for viruses, samot. Alright, so take note of these, baka lumabas sa inyong medicine puhon, alright, if mag-med mo sa CIM, kato akong friend taga CIM to siya nag-med. And igawa sa iyang quiz kato. Again, majority of medical schools, ilahang book for micropara is Jawets. Okay? So, ayan. So, kanisya gikan sa Jawets. Okay? Don't forget. Alright. Now, you know already. Okay? Sa mga mumed dyan. Alright? So, that's for the Retroviridae. Ano siyang Retroviridae? Because again, na siya reverse transcriptase. So, pwede niyang ma-retro. No? Pwede niyang ma-change iyahang RNA to DNA. Okay? So, Retroviridae. That's one of the reasons po why lisod kayo mag-create a vaccine, no? Because of the reverse transcriptase, and your HIV also has high chances of mutation, has high chances and effective means of escaping the immune system gyud. Daghan kay siyang means muna ang lisod ang vaccine. Pero we're hopeful, no, na mga news karon na because of the advent of mRNA vaccines because of COVID-19, na may mga studies, mga trials na gyud of mRNA vaccine for HIV. So sana naman, good ang results para again mavaksinan na ang everyone. Okay? And mawala na ng HIV. Because again, it cost so many lives na gyud, no? It took so many lives na and wrecked a lot of lives po and livelihood. So kailangan na siyang ma-stop. So hopefully, yun, will pray and manifest na kato mga trials karon of mRNA HIV vaccines are effective and good ang results. Alright? Okay, ayan. So that's for Retroviridae. That's why, dears, no, I'm very much sure and I'm very much open to the idea, no, or to the fact that a lot of you are very active, no, in terms of sexually active. So be very careful lang yun because we are medtech. So we already know what are the possible diseases that we can get if ever mangani mag-sex ta unprotected. So be protected. If dili mangani mo ganahang protected, take PrEP, no, pre-exposure prophylaxis. Okay? So again, ay mga free run ng PrEP, go to mga counseling mga agencies, no, to prevent HIV, good dears. Please, I'm sure, I'm very much aware, good, and I'm not judging, good, no. So it's okay ra, good. Basta you are protected and you are safe. Okay? All right. You already know that. Kay medtech kun mo, no. So kabalo naman sa mga consequences. Okay, all right. So that's for Retroviridae. All right. So again, for the structure, here is your HIV. And again, very important, the different proteins and antigens na itong ginadetect, especially in serology for diagnosis. The P24, which is the core found inside. You have GP41, which is a transmembrane protein, meaning naka-insert siya sa imong cell membrane. So for stabilization purposes. GP120 is the structure para mutapot siya, okay, for attachment. Okay. And again, what is the first antibody to be produced against HIV? Kakinsa na antigen ako, IS students ko dyan. Kinsa? Antibody to P24. Please take note. Anti-P24 is the first antibody to be produced against HIV. Okay, take note of that. Then this is the structure of HTLV1, and these are example of leukemic cells infected by HTLV1. It's described as flower cells. As you can see, di ba, mura siyang flower, no? Lobulated iyahang nuclei. So meaning na yung mga lobes iyahang nuclei because of disruption in DNA, maturation, and DNA division, ganun, because of the virus. All right? So that's your the Retroviridae family. Okay? All right. Ayan, sige. Whew, we're almost done. Okay, last two na yun. You have the last, second to the last is the Rhabdoviridae. So your Rhabdoviridae, nasa pangalan na, very important characteristic, it is bullet-shaped. Okay? Bullet-shaped. Mura siya og bala. Mura siya og bala. Okay, bullet-shaped. Okay, okay pa ba? Hello, hello. Alright, kulbaan ko, my God. Okay, Rhabdoviridae, bullet-shaped or conical in appearance. Mura siya cone. Okay, conical appearance. So muna, iyang pangalan, rhabdo, because rhabdo meaning rod. Okay, rhabdos meaning rod. Okay, and a very important virus under this family is, of course, your rabies virus. So again, how do we get rabies? Of course, the bite of an infected animal. Having the rabies virus, pwede po siyang inhalation of aerosolized virus from bat caves or transplanted infected tissue such as cornea or inoculation through intact mucosal membranes. I remember that majority yun of rabies virus are found in dogs, no, worldwide. But other wild animals such as bats, raccoons, no, they can also be infected by rabies. They can be rabid, no, rabies. Rabid, no? For disease, of course, your rabies is fatal unless treated immediately by vaccination. Because again, similar with your polio virus, it affects the neurons, no? So pagpaak sa animal, usually sa tiil ba, from the muscles, the virus will spread, no, from the muscles na mga nerves padulong sa brain, pasaka, padulong dito, all right? And dito na siya multiply and mo cause og disease. And yang i-destroy imuhang neurons. And of course, it can lead to paresthesia at the site of bite, no? Meaning pain at the site of bite. Anorexia, fatigue, and of course, a neurologic phase. And a characteristic symptom of rabies is hydrophobia, meaning fear of water. Maligo siya, hadok siya maligo, madok siya water. Hydrophobia. This is possibly because of neurologic symptoms na. Okay? So for neurologic phase of your rabies, again, there may be seizures, disorientation, hallucinations, and even paralysis, which leads to, again, respiratory failure and then eventually coma and then death. So it can be deadly good samot na if dili siya maagapan. So if mapaakan mog iro, okay, or na ubang references mas scratchan og animal na naay rabies gyud, dapat yun magpa-vaccine immediately. Magpa-prophylaxis ka. Okay? All right. Now for diagnosis, of course, usually if maghulat pa kang neurologic symptoms mo gawas, it's too late na. Because if nanay symptoms, mas lisod na siyang tambalan. If the patient already exhibits symptoms after getting bitten by the dog, nanay rabies, too late na. No, wala na, dili na mo effect ang vaccination or ang prophylaxis. All right? So it's best good na pagpaak, immediately, iwash sa ang wound, of course, to prevent other bacterial infections from cats or dogs. Mga ubang bacteria, iwash ang maayo, and of course, diretso na dayon sa animal bite center or sa hospital magani para sa prophylaxis. All right? Now, for detection, of course, antigen detection, direct immunofluorescence, negri bodies, we have mentioned that already, the CPE, characteristic CPE of your rabies virus. But again, this is seen in brain tissue. And usually makitaan siya in post-autopsy na, no, or post-mortem, sa autopsy na, pag matay na. No? So, that's, makitaan siya dito. And of course, serology, ELISA, you have living patients, pwedeng skin biopsy of at the back of the neck, impression also of the cornea, pwedeng makita ng virus. And of course, as mentioned, the post-exposure prophylaxis. So hatagan mo siya daan og rabies immunoglobulin, no? RIG. Detro gyud dayon, immunoglobulin, antibody na. Because again, kung vaccination pa na, magdugay pa, no? Mag-wait pa ka na ang body mo provide sa antibody. So, diretso na kag antibody mong ihatag, alright? Pero sa Philippines, it's recommended that apilan mo siya vaccination gyud para in the long run, napag protection gyapon ang body. Kay although na siya RIG, rabies immunoglobulin daan, pag vaccinate nimo pod, pag add mo sa vaccination, it will stimulate the body to produce antibodies on its own, okay? Para in the future or para jud mo kalaban pa, para napay additional protection sa imuhang rabies virus if naman gani sa imuhang system. Okay? So that's for the post-exposure prophylaxis. In the Philippines, it's recommended na immediate yun after bite. And then pag-abot dito na yung mga categories. No? Kung ang animal ba kay rabid ba gyud, ang animal ba kay naay symptoms of rabies infection, if kailangan ba jud kag prophylaxis or vaccination na or whatever. So depende sa categories, no? It's stipulated and naka-stipulate siya sa DOH. All right? So but again, to ang rule of thumb gyud dears, if mapaakan, especially mapa-rabies, rabid man ganing animal or dili, diretso gyud na yung tag pa-post exposure prophylaxis para gyud, no, safe, because again it can lead to brain damage and death in the long run kung magpadugay pa ka. And once the symptoms appear sa rabies infection, it's too late, no? Your prophylaxis vaccination will not save you anymore. All right? It can lead to death na. Okay, so that's for the Rhabdoviridae. So again, very important virus lang is the rabies virus. And the joke, sorry ko pa rin. Progression of disease, as you can see, incubation phase, the patient may be asymptomatic. Then prodrome, again, magi sa fever, nausea, and all that. And of course, the neurologic phase, involved ng brain, no? Hydrophobia, sinus symptoms, confusion, delirium, mabuang na siya, hallucinations, and then of course, coma afterwards, and then finally, death. Okay, so it can be deadly samut na if dili siya maagapan agad-agad. And the last of the main families, your Togaviridae. I want to cry. Charot. Okay. Now, your Togaviridae, nasa pangalan na Toga. Toga, na siya'y mantle, no? Toga means mantle, na siya'y covering na marag mantle-like na envelope. Ayan. So, it's enveloped. And again, single-stranded RNA. And this is the last family that contains a lot of arboviruses. Ayan. So, siya ang naidaghang arboviruses. Alright. Now, again, single-stranded RNA enveloped, okay, na virus. Okay. Now we go na to different types of viruses. You have the Rubella virus. So your Rubella virus is the German measles. Now, how do I remember rubiola, which is the normal measles, from rubella? How do I remember ba? Wala ko yung way man good to remember. Basta rubella, bella, daghang L, no? German. What's the difference? German measles, all right? And then for rubiola is your measles lang na normal, walay German. Okay? Gano'n siyang German because daghang patients initially na mga taga-Germany or German ang na-infect. Okay? And rubella means little red in Latin. No? So because again of the rash na ma-form, all right? 3-day maculopapular rash, Japan, and there could be swollen glands. For adults, again, it can be more severe, which could include arthalgia, and arthritis, and even thrombocytopenia or encephalopathy. But these are rare complications. Now, very important lang yun is congenital infection because rubella in the baby or congenital rubella is the most serious complication of rubella because it can lead to congenital defects. No, it can lead to cardiac abnormalities, retardation, deafness of the baby, and even other birth defects. No, so luwi kayang baby. All right. Now, for diagnosis, of course, virus isolation can be difficult. But if needed, you can use urine to obtain the virus. And for RT-PCR, of course, for nucleic acid detection, and for serology, which is usually what we use, we use that for the mother. We test the mother if na by IgM, all right, na rubella, and if positive, it indicates a recent infection. So possible at risk po si baby, all right? And remember that rubella is part of the torch agents, di ba? Siya ang letter R. Not rubiola, rubella. Okay? German measles. Okay, take note of that. So rubella, again, is under the genus, yes, under the genus, oh my God. Na-lost na ko. Under the genus Rubivirus. Ayan. Under the genus Rubivirus. Now, together with measles and mumps, rubella also has one serotype lang. And it can only affect humans. So, possible good siya na for eradication. Pero again, because of a lot of factors pa, vaccine hesitancy and all that, vaccine inadequacy, scarcity, medyo lisod pa good siya mahitabo, no? Pero that's why combines lang tulo, measles, mumps, rubella na vaccine. So 3-in-1. Very important yun para sa mga babies and para sa mga children. All right? Okay. And the next group of Togaviridae are the alpha viruses. Your alpha viruses, sila ang mga arbo viruses. All right? And kinsa ni sila? Mga Synbees, Semliki, forest virus, your weave, your vive, your eve, daming E, your western equine encephalitis, Venezuelan equine encephalitis, and eastern equine encephalitis. Equine meaning gikan sa horse. Ayan, okay. And you have chikungunya virus. Si chikungunya, dears, dili siya Flaviviridae. Dili siya same family with dengue and Zika. It's under Toga Viridae. Pero it's still arbovirus. Okay? Arthropod Vector gyapon. So Arthropod Vector, usually mosquitoes, and sila deers dirita ang dead-end host, especially sa mga Western equine, Eastern equine, and Venezuelan equine. Meaning, kung gikan siya sa horse, ang virus, alright, pag adto sa humans, dili na nato mabalik ang virus sa mosquito. It will stay with us good or dito na siya mamatay. Dead-end host. Okay? Alright. Now for diseases, again, it starts with flu-like symptoms, Japon, that correlate with systemic infection. For equine encephalitis, again, similar gyapon siya with encephalitis na mga symptoms. No? Na involvement sa brain, meningoencephalitis, there could be fever, headache, decreased consciousness, and may often resolve actually without sequelae most of the time. So carry lang siya, di kayo siya na naka-deadly, but it can still progress to paralysis and even death, no, if dili siya maagapan. All right. Now, chikungunya, similar symptoms with your dengue. All right. So crippling arthritis gyapon siya, and usually a week of fever and joint pain. So same good siya. Munang ang chikungunya and dengue medyo same siya o presentation. All right. Now for diagnosis, again, still the same serology and detection of the virus or serological markers in CSF because again of encephalitis and of course RT-PCR, and cell culture using vertebrate and mosquito cell lines. So medyo intense ihang cell lines na kailangan, so that's why medyo difficult po ang culture. All right? So that's for the different encephalitis viruses. Again, your weave, eve, vive, again. Daming letter E. I hate letter E. Joke lang. Weave, eve, vive, again, these are all encephalitis na viruses. All right, okay. So that's for the Toga Viridae. Again, so balik taani na table na nasa Flavi viruses. Usually, combine na sila or usa sila ka-chapter kay same magud sila na arboviruses. So alpha viruses, again, under Toga Viridae, again, muni sila. You have vector, usually mosquitoes, Aedes, Japon, and Culex. The host are birds, pero for the equine, again, kay horses. All right? And then distribution and disease, pwedeng mild systemic and encephalitis. So ang reservoir host kay birds, and then the birds will infect the horses sa equine, and then pwede po siya mosquito from there, mupaak sa humans, dito na mo cause infection. All right? So that's for the Toga Viridae family. Okay. All right. Ayan. And these are the different viruses. Yung rubella, ayan, as you can see, no, the rash of rubella. You have the chikungunya and Western equine encephalitis na virus. Okay. Alright. So, marasag na toga daw. Toga. Marag mantle. No, marasag mantle. Kanang sa earth, no, mantle na cover. Okay. Alright. Now, we go now to the miscellaneous viruses lang, usually, na makuha na to. Number 1 is Astro Viruses. Astro Viruses is under the family Astroviridae. So, marasag stars, di ba, Astro. Single-stranded RNA. And iyahang main disease na ma-cause is gastrointestinal symptoms. All right? And it is a causing minority of childhood diarrhea, and they are usually detected using electron microscopy. All right, astroviruses. So same siya og disease with noroviruses. All right. Next, you have the Borna disease virus or BDV. It's a negative strand RNA virus. It was first isolated or in fact associated with infection of horses in Germany. And iyahang important association lang is neuropsychiatric diseases in humans, no, such as schizophrenia and autism. All right. So in ana iyahang association, na daw association with mental disorders, no, with Borna disease virus. So it's still being studied, no, pero muna siya yung association niya. All right. Next, you have TTV, transfusion transmitted virus. So it's transmitted through blood, no, and it's a DNA virus. All right. Muyang name, TTV, transfusion transmitted virus. So DNA virus commonly found in blood specimens, but have not been associated with any disease. All right. Next, you have hepatitis G virus, of course, also known as GB virus type C, no, because it resembles your HCV. So Flavi virus po siya, same family with HCV, transmitted in blood, and also pwede po siyang ma-produce of chronic hepatitis. All right. Identified by RT-PCR and other RNA detection methods. And of course, the last is your HDV, your hepatitis D virus. It's an incomplete, defective virus, meaning Marshall viroid, no? Incomplete siya. Ayan. Delta agent, no? Responsible for causing 40% of fulminant hepatitis. When you say fulminant, it's a type of hepatitis na padulong siya liver failure. It's deadly, no? It's fatal. It's defective again, ssRNA virus that requires HBV for replication. So if wala HBV, dili siya ka-replicate. Okay. Now, HBsAg, ang surface antigen sa mong hepatitis B, siya ang mo facilitate sa packaging sa virus. And co-infection, when you say co-infection, both viruses, HBV and HDV, have, no, or are found in the patient, meaning nakuha sa patient simultaneous ang duha ka virus. All right? Ang super infection, nauna ang HBV and then isunod na lang si HDV. Ganun. So usually those that have super infection with HDV, existing patients with HBV, those that are, again, existing with HBV, nga napuna ng HDV, mas higher risk of fulminant hepatitis or fatal hepatitis. All right. Now, diagnosis is detection of antibodies to HDV and RT-PCR. Also, ato na siyang i-relate with markers sa imuhang hepatitis B po. All right. So, hepatitis D, again, the presence of hepatitis D will result to a more deadlier and a more fatal na type of hepatitis in patients with hepatitis B na infection. Alright? Okay. Napaba ko? Carry pa ba? Okay. Ayan, sakit ako tutunlan. Char. Pero laban lang. Happy to mahuman. Okay. Alright. Now, these are the pictures. Astro Virus, as you can see, mura siyang stars. Born disease virus, TTV, GP virus C, and of course, HDV. As you can see, ang HDV, dears, kanyang HDV, no? Genome ra gyud siya, and then gamit siya sa HBsAg sa hepatitis B para na siya outer covering, o di ba? Ina na siya ka user friendly. So kailangan jud siya hepatitis B para siya maka-replicate, because if wala hepatitis B, dili siya mo function, dili siya mo replicate. No, how do I live without you pod? Ganong level. Okay, all right. Sige, and these are the markers, no, for your hepatitis B. Asa ta maglantaw sa anti-HBC IgM. Kung positive siya, that means co-infection. Kung negative, super infection. Remember that co-infection man good happens at the same time. When you say co-infection, simultaneous nakuha. At the same time, good nakuha sa patient ang HBV and HDV. So therefore, positive po siya sa anti-HBC IgM kay mukuyog man siya, no, sa pag-progress sa hepatitis B na infection. Whereas ang super infection, mas nauna man ang HBV. So therefore, chronic infection na, no? Chronic na, medyo dugay-dugay na. So possible na wala na anti-HBC IgM. Alright? So later part na lang ni kuyog si HDV, di ba? That's super infection. So therefore, wala na HBC IgM because again, late na, no? Dili na acute infection sa hepatitis B. So later part na lang siya. So munang wala na yung IgM. Alright? So that's the difference, no? Asa sila mo differ sa anti-HBC IgM. Alright? Okay. Alright. Ayan. Sige. And of course, a summary of the classic. Sige rat ang mention ng mga 5th disease, mga 6th disease. Kinsa mo gina sila. So muna sila 6th disease na mga number because these are the classic exanthems or mga rashes found in childhood, no, in mga children. And ilang ginumber. So kinsa tong first disease, si measles or so rubiola, all right? Second disease is scarlet fever caused by Streptococcus pyogenes. The third disease is rubella, German measles. Fourth disease is your Filatov-Dux disease, pero this is obsolete na. The fifth disease, ayan, kinsa na cause ani, your erythema infectiosum, of course, parvovirus B19. And of course, your sixth disease, your Rosola infantum or exanthem subitum, this is caused by HHV6. Take note of this, muna nga childhood exanthems or mga rashes found in children. Okay? All right, so that's for childhood exanthems. And of course, kinsa itong mga oncoviruses, we have 7, HBV, HCV, which causes hepatocellular carcinoma. HPV, again, causes cervical cancer, penile cancer, no, and also mga oropharynx na cancer. EBV, Burkitt's lymphoma, Hodgkin's lymphoma, nasopharyngeal carcinoma, etc. HTLV1, of course, adult T-cell leukemia. KSHV or your HHV8, Kaposi sarcoma, associated herpes virus, which causes Kaposi sarcoma and primary effusion lymphoma. And the very recent yun pinakabago is MCV, your Merkel cell carcinoma under the Poliomaviridae family, diba? It causes Merkel cell carcinoma, which is a type of cancer sa skin. Okay, so these are the oncoviruses, meaning viruses that promote cancer, okay, that can elicit cancer. Okay, all right. Okay, all right, ayan, sige. So that's for the viruses, the oncoviruses. All right. Okay, so we now continue to the last part na gyud. Ang tingong wala na gyud ka puy nako. But anyway, laban lang, no. This is the last part na gyud of virology. Daghan na lagi yung daghan kayong viro. Daghan mo chika. But anyway, this is the last part na gyud, which is your prions. Now, your prions, take note, these are not viruses. Actually, they're not viruses, but they're actually proteins, no? They are infectious protein particles that can cause disease. And usually, asa sila makakause of disease? Sa brain. All right? Now, this is transmissible. Hindi pwede siya matransmit from groups, no? Humans to animals or animals to humans. And they cause what we call transmissible spongiform encephalopathy. So, example of that is si Creutzfeldt-Jakob or Jakob disease in humans, scrapie in sheep, bovine spongiform encephalopathy or mad cow for cattle, and of course chronic wasting disease sa mga deers and elks. All right. Now, because they are proteins, they are very much resistant to inactivation using disinfectants because again they are proteins. Now again, they are not viruses, ha, they are just proteins. Ang naaragod nila kay protein na material or protein na structure. All right, so alpha helix, beta pleated sheets, no, beta katong sa tawag na alpha, nalimutan ko your alpha structure, and then beta helix, diba? And then pleated sheets. And anara, normal protein regular structure. Wala siya genome, wala siya envelope, wala siya anything. No, it's just a proteinaceous particle. All right. Now, these prion diseases can be genetic. It can be inherited, such as your CJD, your Creutzfeldt-Jakob disease, your Gerstmann-Schosler-Scheinker syndrome, GSS, and fatal familial insomnia. Now, how do we get this prion disease? It's through transmission via infected tissue, such as mga transplantation, no? Or inheritance, no, genetics. Aside from that, it can also be acquired through ingestion, okay, of contaminated brain or mga meat na naay prions, cuts in skin, transplantation of contaminated tissues, again, such as cornea, and of course, use of contaminated medical devices. Diba, remember, that's why daghan kaayo sa ato ang mga blood banks, organ transplantation, na i-mention dito about deferral, kung na kay Creutzfeldt-Jakob disease. Because again, it can be transmitted through transplantation or even transfusion. That's why kung na kay Creutzfeldt-Jakob disease or history of Creutzfeldt-Jakob disease in the family, you are considered in sa mga deferral permanent because again it can be transmitted. All right, okay, now what are prions? No, in the body we have a normal prion protein known as your PRP, kanisha, no, your PRPC or PRP, that's a normal prion protein found on the surface of cells. Now this prion protein can be abnormal, okay, and it becomes what we call PRPSC. So paras ani ang normal daw kay helix, all right, which is the normal prion protein found in cells, para siyang mahimong pleated sheets, mo flat siya. And that is now the abnormal na protein which is infectious and causes the disease. All right? Now, wala pa na-establish kung unsay mechanism ngano siyang ma-abnormal, pero one of the hypotheses is that the protein, kanisang normal protein, may have interacted with a foreign nucleic acid such as a virus ba or kung asa man, which triggered to be abnormal to form this PRPSC. So ang PRPSC, muna siya ang prion protein na abnormal which causes the prion disease. Okay? Alright, ayan, sige. Now we go na to the diseases, your spongiform encephalopathy. So sa pangalan niya, spongiform because ang appearance sa brain or sa brain tissue usually kay murag sponge, no? Spongiform encephalopathy. So vacuolated ang neurons, no? Nagbuslot na sila, vacuolated, and loss of function and lack of an immune response or inflammation. So it's a progressive degeneration of your CNS, which is ultimately fatal, and long incubation period. Again, vacuolation of neurons. As you can see na yung mga dagkong circles na, the vacuoles inside neurons, and that's why it's called spongiform. Kumara sponge in appearance. All right? Now, diagnosis is we detect this protein, 1433 or tau protein, or again, real-time quaking-induced conversion, which we use to detect the PRPSC. And we have mentioned that the PRPSC is the abnormal prion or the one that causes disease. All right? Now, for the different diseases, you have CJD. Your CJD, again, usually affects older people. You're 50 years old, usually. We have also a variant CJD, and usually this is seen in UK, United Kingdom, and it was attributed to eating contaminated beef, cattle, no, that usually are infected with the mad cow disease, no? So if nikaon ka contaminated beef that contains the prion, you may be infected by the variant CJD. Ang variant CJD, usually mga younger people ang ma-infect. Okay? So pagkaon mo sa meat na naay prion, na katong abnormal na protein, the abnormal protein will be digested, of course, and mothers sa brain, and the abnormal protein will trigger the normal prion protein sa imuhang brain to be abnormal. Mag-abnormal folding na siya, so which now leads to spongiform encephalopathy and the disease. All right? So, dira muna yung mechanism if makaoni mo siya, ang prion from contaminated beef. All right. Now, kuru, it means shivering or trembling. It's limited only to an area in New Guinea because of their cannibalistic practices. Ayan. So, ilahang tribe, no? Tribe, indigenous tribe. So, they eat, no? Each other. Literally, maling-mali. Nag-eat sila sa ilang mga body parts, some of them mamatay, no? So they eat the brain, no? So if ang infected patient can ay spongiform encephalopathy, na prion siyang brain, so pagkaon niya, pwede po siyang ma-infect. Parehas sa imuhang variant CJD. So inana. But because of this cannibalistic practices na wala na kayo gi-tolerate, wala na kayo gi-practice sa New Guinea, medyo nawala na ang kuru, okay, because of these the stoppage, no, wala na kayo yung nag-practice aning cannibalistic practices. Okay, all right, so that's for the different diseases caused by prion. So it's affecting the brain, spongiform encephalopathy because of the appearance, no, of the neurons vacuolated, mura siyang sponge. All right, and again, di ba, remember, at least kabalo naman si Creutzfeldt-Jakob or Jacob. I'm sure, sige, nagibalik-balik sa blood bank, di ba? Because permanent deferral na siya if you have a history of Creutzfeldt-Jakob. Why? Because again, your CJD can be genetically inherited. Okay? And it can also be transmitted to others. All right. And deadly ang outcome sa disease. All right. Okay. Now, for the last part na lang is your viral vectors. Now, what are viral vectors? Wala niya sa inyong notes, pero ako nang i-upload ng PowerPoint para na may copy. The viral vectors, usually, when we say viral vectors, your viruses, kasi sige naman tangga-mention na makakos ng disease, na siya'y advantage or na siya'y good side. And that is, we can use these viruses, we can manipulate them to transmit and to deliver wanted genes, mga tambal naman gani or whatever, to humans para makatambal or makatreat og disease, and that is viral vector, no, for therapy. So these are again genetically manipulated viruses that are used for delivery. So sila atong courier, parang ganun, siya ang Ninja Van, Shopee Express, ganun. Okay, sa atong mga ganahang genes ba or tambal or like sa vaccines example for humans para ma-treat a specific disease. Okay, all right. Now viruses again usually used for gene replacement therapy. So this is usually used sa mga genetic diseases, no? I-replace ang gene sa atoang cells, i-replace ang gene na faulty or defective by the normal gene which is delivered by the virus para matambalan tong atong defective genetic disease, all right? Aside from that, it can also be used as sa vaccines to promote immunity. It can also used to kill tumors and also yeah, it can also kill tumors because of, especially kato mga retroviruses, di ba? They are able to integrate to the chromosome. Pwedeng magbutang tag gene dito na makapatay sa chromosome, sa imuhang tumor, pwede po. So, muna siya mga possible usage of viral vectors. All right. Now, again, example of virus, the advantages is that your viruses can be readily amplified, all right, by replication, and it can also target specific tissues because they are because of their tropism, di ba? They have specific types of tissues na ganahan sila. Alright? And pwede nilang ma-inject ilahang RNA or DNA sa cell mismo. So therefore, pwede na itong mabutangan og gene na itong ganahan ang virus na itong viral vector and then iyang inject iyahang genome sa imuhang cell or host cell. Alright. Now, sa itong mga viruses na itong ginagamit, again, retroviruses, adenoviruses, yes, very common ang adenovirus, good dears. Your HSV and adeno-associated viruses, which is under your parvovirus. Your pox viruses, such as vaccinia and canary pox, and some of the toga viruses. Alright? So these are the viruses usually na itong ginagamit as viral vectors. Ayan. So here's an example. Adenovirus good, usually pinaka-common good as viral vector. Alright. Now, viral vectors again, they are the normal virus pero ato siyang gipa-defective, no? Ato siyang gikuwaan og mga essential genes na makakos og infection. Alright? So the normal virus atong gikuwaan og mga defective or attenuated na defective, gikuha na itong mga essential genes atong palitan atong kailangan na gene na masulod sa lawas, alright, as the viral vector, alright? So defective virus, again, they are grown in cell lines that has and expressing the missing viral functions, complementing the virus, meaning wala itong mga essential genes na makapahimong infectious niya, alright? The progeny can deliver their nucleic acid and not produce infectious virus, alright? So retroviruses and adeno-associated viruses, they can integrate again into cells and permanently deliver a gene into the cell's chromosome because of their ability of the reverse transcriptase. Adenovirus, HSV, promote targeted delivery of foreign gene to receptor-bearing cells. Genetically attenuated HSVs, oncolytic, used to specifically typically kill mga tumors, no, of glioblastomas, while sparing the surrounding neurons. And your adenovirus canary pox, again, usually used for vaccines to carry and express HIV and genes needed for vaccines. True enough, di ba? That's why COVID-19, no? Vaccines. Daghan kayong viral vector vaccines. And kinsa na sila usually your AstraZeneca, the Janssen, and Gamaleya from Russia na mga vaccines. They're all viral vector vaccines. And again, silang viral vector, adenovirus. Huwag na mag-isip. For Janssen, for Astra, it's the chimpanzee common cold virus, ChAdOx1, no? Chimpanzee, CH, muna siyang ChAdOx, CH, chimpanzee, AD, adeno, and Ox kay Oxford AstraZeneca, di ba? So, AD, adenovirus niya siya sa chimpanzee, no? Common cold virus. For Janssen, it's adenovirus 26. For Gamaleya, it's adenovirus 26 sa first dose, and then adenovirus 5 sa second dose, no? So, lahi na viral vector. Now, you don't have to be scared again, especially sa mga family members. Basta makating sila na, hala, oh my gosh, nag-inject sila virus na ako. Oo, nag-inject sila virus, but this virus cannot cause infection. It's non-replicating, meaning dili siya kayang mo produce pagdaghang virus. Usara gyud siya, pag uptake sa cell, mawala na po siya. Ang purpose ra gyud niya is to deliver the necessary material, in this case, protein subunit of the coronavirus into the cell, para ang atong cells mo create og protein subunit, alright, that is protein subunit of the coronavirus, ma-express sa surface sa ato ang body cells para ma-detect siya sa ato ang immune system to produce antibodies. So that's the mechanism of viral vector vaccine. Igo na siyang tagahatod, no? Courier, delivery, inanara, okay? Alright, so dili siya makakause og infection, dili pod siya mo replicate, dili siya makapadaghan sa iyang self. Okay? So please take note of that, all right? Para ma-explain niyo tarong sa inyong mga family members na hesitant to be vaccinated. Okay? Very important good to be vaccinated, dears. Alam niyo na yarn. Okay. Now again, for mechanism, ayan, as mentioned, the viral vector vaccine has the gene for the spike protein, no, of the COVID-19. All right? Now pag sulod sa lawas, no, pag sulod sa lawas sa viral vector vaccine, the viral vector will be uptake or will be endocytosed by your cells in the body, and the cells in the body will then process the gene to produce the spike protein of COVID-19 virus, all right? And this spike protein will be alerted or will be noticed by your immune system to produce antibodies na, all right? And that is our protection na against your COVID-19 virus, all right? So take note of that. Viral vectors, very ano gyud dears, kanang high-end na gyud siya, no? Like dako kay siya na pagka improvement yun in terms of our treatment. Pwede tayong gamit og viruses. But again, we don't have to be scared. Again, educate your family members, friends very well. Acquaintances yun na dili na siya makakause og infection, igo na siyang tighatod. Okay? Alright, ayan, sige. That's for the viral vector vaccines and viral vector therapy. Alright, and for the last, part na gyud antiviral agent. So take note of mga vir, acyclovir, mga vir, that's for for viruses. All right? Take note sa mga inhibit usually mga enzymes needed for replication of the virus and needed for proliferation of the virus. All right? So another one is from URE. Ayan, unsay mga gina-target, attachment, transcription, nucleoside, assembly, etc. So unsa na mga tambal. Again, as medtechs, dili na kailangan na mag-memorize sa mga tambal. Okay? It's not in line with our work. Okay? So as long as we know kung say mode of action, unsay gina-target, and mga ngalan sa tambal. Basta mga vir, zidovudine, mga vodine kana, that's for virus. Okay? All right, ayan. So that's all for virology. Yes. Imagine 125 slides ra siya pero pila ka videos akong kailangan gigama and nadugay kita. Unlike sa Myco na nabot og 200 per dali ra kita. Dagan mo kung chika kay sa viruses, no. My God, mabuang ko. All right. So that's all for virology, dears. So I hope naramoy na learn gapon. I'm not sure kung ma-view ba ninyo ni before the conference, siguro after na, or if ever ma-view pa ba Japon nimo ni ambot kung ma-view ba gyud ever ni nimo, sige na lang. But I hope lang gyud na namoy na learn, no? Medyo nakuyon po ko sa video kay daghan kayong complex na concepts, and I hope na explain na po na ko siya. And pasensya if medyo kulang, yun lang yung kaya ko. No? I need to study more. Yes naman, pero I hope na ka-learn na gyapon mo. All right, so that's all for virology. We're done na gyud with micropara. Yes. Last topic na lang yun for didactics, your CM, your clinical microscopy, which we will begin in the next few days. All right? So thank you so much for watching, Gears. I hope maka-watch good mo. God bless ninyo. Keep safe. All right. And thank you for watching.